In this project that was presented by one of my fellows, we were trying to understand the impact of bone metastases in patients who had metastatic urothelial cancer. We know that bone metastases are a significant source of morbidity and mortality in bladder cancer, and our concern was that these patients sometimes do worse than patients who maybe don't have bone metastases. So that was really the hypothesis of this project. So we did a chart review, it was a retrospective study, and we tried to tease out how many patients had bone metastases and how their outcomes were the same or not the same as patients without bone metastases. And essentially we found, as per our hypothesis, that patients with bone metastases perhaps do a little bit worse than patients who don't. The challenge has always been bone metastases often gets lumped in under a category called visceral disease, which includes lung and lymph nodes, and it's all together. So I think we probably need to look at pulling it out and looking at it as a criteria of itself, in and of itself. And then following up on that, or perhaps in parallel with that, I have an investigator-initiated trial going on looking at the addition of a bone-targeted treatment to standard chemotherapy in first-line bladder cancer. So it's this idea of saying, okay, we know bones can be affected, can develop, we can get metastases to bones from the bladder cancer. Is there anything we can do to prevent or reduce the impact of that on a patient?